Good morning, ma'am.
Yeah, good morning.
How are you, ma'am?
Yeah, fine.
Very nice to see you.
Yeah, nice to see you too.
In college, ma'am, now. Good morning, ma'am.
Yes, yes.
Good morning.
How are you,
Narisa
ma'am?
ma'am,
Yes.
Ravindra, hi.
Yes.
Devraj is muted. Good morning to all of you. I don't know.
Long
How
time.
many?
Morning.
Yes.
Good morning to everyone, ma'am.
Good morning. Narisa ma'am, how are you?
I'm fine. Long
After
time.
so many years, I think you're seeing each other.
Yeah.
Ravindra Gandre na bette agila. I've never met Ravindra. Just spoken to him.
No, I actually been, I and Larissa ma'am met in Indian Nursing Council, but in those two occasions, you have nothing. So far we could not meet.
Correct.
No, in case situation clears, let us meet, ma'am.
Yeah.
So one side it's a great contribution of COVID and the fortunate side of COVID that at least we could meet virtually. So this becomes so viral now. So viral meetings, webinars are becoming more and more.
Correct.
Good morning, Dr. Ramesh Sharma sir.
Very good morning.
Yes.
Good morning, Sudha ma'am. How are you?
Hi Anil, कैसे हो आप? Good
बस
morning.
एकदम बढ़िया. Good
एकदम-
morning, Larisha ji. How are you?
Yeah, fine, sir. Good morning to you too.
कैसा चल रहा है सुधा मैडम वहाँ पे? All good.
बिल्कुल।
COVID under control.
Under control, all good.
Great.
बीएससी के क्लासेस शुरू हो गए हमारे 20 तारीख से.
अच्छा. नया सेशन शुरू किया है अब.
नया
अरे।
सिलेबस.
Good morning, sir. Anil, sir.
Good morning, देवराज जी. कैसे हैं आप?
बस ठीक है, sir.
Great to see you here.
Thank you, sir.
Devraj ji, you can start now.
Registrar madam is joining just a minute. Registrar madam just settle for it.
बॉडी नोट बन गई है.
Yeah, Pragna madam has already joined.
हार्ट अटैक.
Already joined.
Good morning, ma'am. Pragna ma'am, good morning. Mute हो गया.
Very good morning.
गुड मॉर्निंग प्रज्ञा मैम.
Very good morning.
Good morning, Pragna ji.
Very good morning, sir.
Good morning to everyone, one and all dear participants and all panelist members, and a special I extend my thanks to our registrar ma'am, Dr. Pragna Dhavi ma'am, for giving a valuable time, and all panelists or eminent professor or academicians for giving time, special time into today's panel discussion. Before starting panel discussion, just I want to share something like that. And nowadays there is something extraordinary time, or Indian Nursing Council just emphasis to change in BSc Nursing syllabus. In that view, Parul Institute of Nursing, Parul University plan to discuss by the using different kind of like the strategy or a different kind of for seeking the different kind of opinion, invite the guest and use the virtual by using the virtual mode, try to discuss on panel discussion. Now, first of all, before proceeding the discussion, just I want to introduce our today's guest or expert. Our chairperson today's panel discussion chairperson is Ma'am Dr. Pragna Dhabi, currently Ma'am serve as a registrar, Gujarat Nursing Council, Gujarat. Ma'am completed MSc Nursing and PhD Nursing from Gujarat University. Ma'am have a wide experience in administration, academic and teaching, and as well as research also. Ma'am participated in various conference and seminar as a chairperson. Ma'am also give the valuable contribution to enhance the nursing field and teaching and research, and ma'am also guide time to time to provide the valuable contributions and empower the nursing professions. not only in Gujarat, throughout the India also. Next, our panelist, Dr. Larissa Martha, ma'am currently working as a principal, Lakshmi Memorial College of Nursing. Ma'am completed BSc Nursing in 1993 from Father Muller College of Nursing, Mangalore University. Ma'am completed MSc Nursing in Medical Surgical from Manipal University. Ma'am completed MPhil in year 2000 from the Manipal University also. Ma'am completed PhD Nursing from Vinayaka Mission University, Salem. Ma'am also member of various professional body like the TNI, Karnataka Nursing Council, SINN, ONI, NRSI, CN. Ma'am have a wide experience in UG, PG, and PhD guiding. Overall, around 24-year experience. Now, ma'am also serve as a vice president for TNI Karnataka State Branch since 2019. Ma'am also member of various board of studies and academic council member for various universities. Ma'am also guide the various research scholars at various universities. Ma'am also examiner, coordinator, program coordinator, and also certified by various degree and diploma courses. Ma'am also serve as a resource person for HIV ART training organized by NSU, organized by Manipal University, Mangalore. And ma'am also served as a speaker in national and international conferences, approx 68, and ma'am also published a national and international paper in various journal, various level journal, approx more than 50 to 60. Now ma'am also work with the collaborative project and research project and accept the grant in 3 to 4 research. Ma'am also currently active member in universities as examiner and evaluator. Now we proceed for our second expert, Professor Dr. Sudha Reddy, ma'am. Ma'am currently working at KHCR Institute of Nursing, Mangalore. Ma'am completed BSc Nursing in 1992 from AFMC Pune, and ma'am also completed MSc Nursing from Kelly College of Nursing, Karnataka. Ma'am completed MPhil in 2006. Ma'am completed PhD Nursing from INC Consortium RGUHS. Ma'am have more than 18-year experience at university level for teaching, administration, and academics. Ma'am also served in AFMC also. Ma'am also awarded as a Best Researcher Award from the Manipal University. And ma'am also served as a Vice President TNI Belgavi Division. Ma'am also active member of INC Ad Hoc Inspector in UGC also. Ma'am also editorial board member of various international and national journals. Ma'am published more than 120 research paper in international journal, and ma'am also invited as an expert research at international level like that country, Vietnam, South Africa, Philadelphia, Sweden, Canada also, as well as ma'am also guide and mentor for the nursing profession and time to time provide a valuable contribution for the nursing also. Next, our third panelist, Dr. Ravindra H. Sir, currently working as a principal at Parul Institute of Nursing, Parul University, Vadodara. Currently, sir have a more than 16-year experience in teaching, academic, and administration. Ma'am, sir completed BSc Nursing, MSc Nursing, and PhD Nursing in Medical Surgical also. Sir is also served as a active member in INC Ad Hoc Inspector and also Inspector at Gujarat Nursing Council. Sir also paper setter, examiner, evaluator, and POS member for various universities at Gujarat and as well as a national level. Sir also published more than 35 paper at international and national journals. Sir also member of academic council members for different universities throughout the India. Our next panelist, Professor and Dr. Anil Sharma, sir. Sir currently working at a Charusat University College of Nursing, Charusat, Gujarat, Anand, Gujarat. Sir completed PhD Nursing in 2016 and MSc Nursing in Medical Surgical. Sir have a more than 17-year experience in teaching and research. Sir is active member of currently Nursing Research Society of India. Sir also member of NRSI and BNCRP provider course. Sir acquire a BNCRP provider course at Charusat, and sir is also active member of IQAC committee member at Charusat University, for the nursing branch. Sir also published so many paper in Web of Science and Scopus Journal. Sir is also editor and reviewer of various international journals. Sir also served as a board of studies and external member at NMS University, Vadodara and UK Tarsadia University. Sir also examiner, PhD expert and examiner for the RGUHS INC consortium. And sir, if we talk about the expert area, clinical research area of the sir, then area is epidemiology research, methodology research. Sir currently working for Charusat University, Changa Anand, as a principal advisor and academic. Sir published more than 45 research paper in international and national journals. Sir also invited as a guest speaker for more than 45 workshop, conference and seminar, and also chaired 5 international conferences. Thank you. I extend a special thanks from the Parul University, Parul Institute of Nursing, Vadodara, for giving a valuable time from all panelists. Now we are proceeding for panel discussion. And I also welcome all audience and experts on behalf of Parul University also. So before starting the panel discussion, I want to explain about something like that. Our today's panel discussion mainly topic on implementation strategy and guideline for semester system in BSc Nursing Council that was given by the Indian Nursing Council. Indian Nursing Council is a regulatory body that working in India, that provide a wholesale opportunity to state nursing council also to implementation and revision and making the provision, special provision for the syllabus. Today's objective for panel discussion is to develop and understanding the differences in various curriculum, revised curriculum, to discuss and analyze the significant benefit from different perspective of revised curriculum. Third objective is to understand the current future challenges for student and teacher in implementing revised curriculum. Our fourth objective is to encourage the nursing faculty in implementing the revised curriculum. So now we proceed for sub-theme. Before proceeding our panel discussion, I request to Dr. Prakna Dhabi ma'am to share opinion regarding today's panel discussion. Ma'am, please.
Good morning to one and all. First of all, I would like to congratulate Parul University and your entire team for taking initiative for this workshop. It is really in need of an era, and it will be, I am sure that it will be helpful for faculties as well as for our students. We all know that we have old syllabus, and in that we did not have semester system or credit-based system. And now the WHO also has declared that this year is a year of nurse and midwife. And there are a lot of expectation from nurses, especially to have a competency. And this new syllabus really serve our objective. So if we talk about the specific area for this syllabus, that is, one is the credit-based system, second is the semester system, and third is the competency-based system. See, more or less, there are no difference in the subject, but how we implement our syllabus, there are many differences. So it will be really, really helpful for our faculties as well as for our students and as well as for our profession. Majority of the guidelines, well-established guidelines by Government of India, we have implemented in this syllabus. As this is a new syllabus, I can understand there are many challenges. It will be difficult for us to implement semester system because our admissions are late, and there are some challenges definitely. But along with these challenges, I feel that there are many benefits for our profession. So all together we can solve and we can discuss these problems. What may be the challenges, that also we will discuss, and we will find out that what will be the best solution. But personally, I feel that this syllabus is really, really, very good, or I can say that excellent for our nursing profession. So let us have some discussion And any of the problems, if you know that we can find from this discussion, we definitely discuss that and we will find out that what best possible solution is there. So, you know, I have a very good vision and I'm very happy with this new syllabus. Thank you.
Thank you, ma'am. Thank you so much for sharing the opinion and view regarding the revised curriculum given by the Indian Nursing Council. And ma'am also share like that challenges and benefits. What is the basic benefits for the nursing professional as well as students also. It will also definitely we all are in favor like that. Definitely it will help to enhance the nursing profession as well as it help to implement the new strategy like that in we can see in other courses also. Again, I would extend my special thanks for sharing opinion. Thank you, ma'am. Now we proceed for a second sub-theme that was presented by Dr. Ravindra HN, sir, panelist. No, sir. Yeah, I'm not. So, sir, I request to you regarding the presentation of highlight of proposed syllabus.
Thank you. Good morning, Manindra. Good morning, respected President and Registrar. Good morning, Carissa ma'am, ex-member. Dr. Sudhar ma'am, principal, KLE Medical College, College of Nursing, Belgaum, and Dr. Anil Sharma, sir, principal. This is indeed very necessary to have a panel discussion on the unknown facts of this new and revised Indian Nursing Council syllabus. Whenever the changes happens, we know that there will be resistance and also there will be some apprehension. So apprehension, resistance, and the challenges can be vivid or minimized by proper discussion. So this is one such sort of effort from our end to have a panel discussion and to make the administrators, deans, principals to understand and to give some guidelines to implement the revised syllabus. So when we approached the panelists, panelists across India, so they readily accepted and now it's happening. So there are more than 300 registrants. Enthusiastic participants are also registered, and we do now. They are all for the first time amongst all the programs that we have conducted. So only except the students, a huge number of aspirants have come up. A good number of participants are also present here. So I thank all the enthusiastic participants. So let me go ahead with my presentation. Is it visible?
Yes, sir. Visible.
The revised syllabus has amalgamation of fundamental courses like anatomy, physiology, microbiology, biochemistry, and the core courses of nursing and few 17 elective courses. So it's a mixture of all three, competency-based, credit-based, and elective courses. So these core competencies are patient-centered care, professionalism, teaching and leadership, system-based practice, health informatics and technology, communication, teamwork and collaboration, safety, quality improvement, evidence-based practice. So the main highlights of this 4 years course, which are divided into 8 segments, 8 semesters, which are made 7 examination going, teaching semesters and 1 internship semester. The first semester consists of communicative English, applied anatomy, applied physiology, applied sociology, applied psychology, and practical nursing foundation 1. And in the second semester, applied biochemistry, applied nutrition and dietetics, new nursing foundation 2, health, nursing informatics and technology. So here the first year subjects of the present existing, out of which the microbiology has been taken and removed, placed into second year, and rest of all the existing subjects are being kept. Instead of anatomy and physiology, this is being kept as applied anatomy, applied physiology. Sociology has brought from second year and kept in the first year. So basic behavioral science and medical sciences have kept in the first and second semester. And in the third semester, applied microbiology and infection control, including safety, pharmacology first, pathology first, adult health nursing or medical surgical nursing 1 with integrated pathology in the third semester. Whereas in the fourth semester, pharmacology second, pathology second, and genetics, adult health nursing 2 with integrated pathophysiology, including geriatric nursing, professionalism, professional values, and ethics, including bioethics. So this is about 4th year contents. And in the fifth semester, child health nursing, mental health nursing 1, community health nursing 1, educational technology, nursing education, introduction to forensic nursing and Indian laws are kept in the fifth semester. And in the sixth semester, continuation to fifth semester, all the subjects, child health nursing 2, mental health nursing 2, nursing management and leadership, midwifery, obstetrics and gynecological nursing 1. So these are placed in the sixth semester. And in the seventh semester, community health nursing 2, nursing research and statistics, midwifery, obstetrics and gynecological nursing 2. So these are the subjects in the seventh semester. And in the eighth semester, internship. So here in the summary, we have first semester 2 exam going papers and communicating English is a class exam. And in the second exam, let me come back to that point, examination system. So here mandatory modules are there. So first semester nursing foundation incorporated inside into the nursing foundation subject is first aid. And in the second semester, health assistant as a part of nursing foundation 2. And BCLS as part of adult health nursing. And in the fourth semester, fundamentals of prescribing under pharmacology 2, palliative care module under adult health nursing 2. Mandatory module in the fifth semester is essential newborn care, facility-based newborn care, IMNCI, and pediatric life support as part of child health nursing mandatory modules. And in the sixth
क्या हुआ देवराज?
I guess some technical issues, maybe electricity or something else.
Mm-hmm.
Yes, sir, audible, please.
Anil, you are implementing it this year, this new syllabus?
No, ma'am. Actually, there are some doubts. We wrote to INC because there are some credits which is yet not been. They have no idea that how we are going to evaluate it. Then we are also not clear of. I even asked to Pragna ma'am that what is the philosophy to keep one subject in one semester and taking the same subject examination in the second semester. So we wanted to keep in the same semester. Let us say if we are teaching the nursing foundation one in first semester, we would like to evaluate in the same semester instead of taking it to the next semester. So still there are a few more doubts. We have written to the Indian Nursing Council. We are waiting for that because they have already given this flexibility. And moreover, the first batch maybe start like this session will start by January. So still we have time 2-3 months. If they'll come up with the solutions, then we will see to it. Did you start that? Full
From
fledged?
this, yeah, we got it passed in our first in the college council meeting, then board of studies of the university, then academic council.
Okay.
And 20th of September onwards, we started online the Diksha Rambha for them because the orientation has to begin as per UGC guidelines. And the other day, all 100 students have come physically to college, and we have started with the things. And credit system, we are used to it because our pharmacy colleges and all have that. So we have the whole thing set in our exam system. So I don't think we'll have any issues with that. And whatever syllabus they have prescribed, we are following. Like we didn't have any.
Like semester and credit system, we are following since 2009 in nursing.
Great, I didn't know that. Very good.
Yes. In UG and PG both. So our faculties are well acquainted with the semester, and that's the reason we had more doubts. Because we were knowing that how the system should go. For example, you cannot keep, for one examination, 2 paper codes. That was also one of the doubts. So that's the reason we wrote to INC, and that we took that chance to implement it by next year. It will not able to resolve our doubts.
क्योंकि you are doing it now, so you knew the practical problems.
Yes.
हम लोग तो पहली बार कर रहे हैं, so we agreed with whatever they were
Even
doing.
we implemented the choice-based credit system 5 years ago.
Very good.
Which they are talking about the elective modules. So we are doing it. We are offering the university electives as well as the program electives. So like our nursing students are taking the courses or the subjects from management, engineering, they are understanding how to develop the website, how to develop the mobile application by offering by the computer application departments. So such electives are there.
We have value-added add-on courses.
Yes.
And interdisciplinary courses. So उसमें काफी सारा जो भी INC के जो elective modules हैं, we were already offering. So it will be easy for us to continue with the same.
Right.
But what happened to Ravindra? Like if he is not there, the Larissa madam can go on with the Devraj. Can we go to Larissa ma'am till Ravindra joins in, or shall we wait? Because only उसका थोड़ा descriptive है, हम सब लोग का तो सिर्फ ऐसी discussion ही है. हाँ.
Dr. Devraj, I think both of them are not there.
Yeah, they are resolving the issues then.
Okay.
Sorry for the inconvenience. So let me continue. In the first semester and second semester, we have already concluded. And in the third semester, we have microbiology and infection control, pharmacology, pathology 1, adult health nursing 1. And there are totally 220 hours of theory and 480 hours of practical, totally 800 hours. And in the fourth semester, Pharmacology second, pathology second, and genetics. Adult health nursing 2, professionalism, professional values, ethics, including bioethics. So totally it accounts to 40 theory hours and 480 of practical hours, and totally it's accounts 800 hours. So in the 5th semester, child health nursing 1, mental health nursing 1, community health nursing 1, educational technology and nursing education, introduction to forensic medicine and Indian laws. So total of 14 credits, 280 hours, and skill lab 8 years, and 400 clinical content. Total of 800 hours. In the 6th semester, health nursing 2, mental health nursing 2, nursing management and leadership, midwifery and obstetrics nursing. So totally it's of 10 credits, 200 hours, 40 skill labs, and 560 clinical content hours. So totally it's of 800 hours. So in the 7th semester, community health nursing 2, nursing research and statistics, midwifery, OBG nursing 2. So totally again it's 10 credit hours, 200 and 480 clinical hours. Totally it happens 800. So in the 8th internship semester is community health nursing 4 weeks, adult health nursing 6 weeks, child health nursing 4 weeks, mental health nursing 4 weeks, and midwifery 4 weeks. So totally 12 credits, so 1056 hours. So in a summary, there are totally it varies from 720 to 80 hours per semester, and it's of 26 weeks. So in the internal assessment, in the first semester, it gives 10 marks weightage to the continuous assessment for all the subjects and 15 marks for sectional exams. And similarly to the second, third, fourth, and fifth. Little variation in the practical. So whereas in the community health nursing and OBG, there are 20 child health nursing, there are 20 continuous assessment, and theory or practical assessment marks are 30. So otherwise it is 10 for the continuous assessment and 15 for the practical or theory examination, sessional examination marks. So how do we calculate this continuous assessment marks? So it is given here. So it is for 2 marks for the attendance, written assignments 10 marks, seminar micro teaching individual presentation for 12 marks, group projects, works, or any other reports 6 marks. So totally it accounts 30 divided by 3, then it gives the marks for 10. So if there are any mandatory module in that particular, there are in up to 7th semester, in every semester there are mandatory modules. So then this needs to carry 10 marks. So totally it becomes 40. So then 40, that is 2 for attendance, 10 for written assessment, seminar 12 marks, 6 marks for group project, and 10 marks for the mandatory module. So this accounts 40, and 40 divided by 4, that's 10. So then 10 has to be calculated for the continuous assessment, and 15 marks need to be brought from the 2 examinations, sessional examinations. So 2 sessional examinations per semester, per course. MCQ 4 marks, essay 1 question into 10 marks, short essay 2 questions into 5 marks, very short answers 3 questions into 2 marks. So the totally 30 marks into 2 examinations, total 60, that need to be divided by 4, and it gives you marks for 15. So that 15 plus 10, it accounts for 25. So 25 internal marks and 75 exam papers. So here it is again how to conduct the examination for the practicals are given here. In the practical examination, again 2 marks for the attendance, So this was in the discussion earlier so far, and this was an institutional policy, but it was not so far an council policy. But attendance now made us the evaluate. Clinical assessment for 10 marks, continuous evaluation of clinical performance for 10 marks, end of posting OSCE examination, 5 marks, completion of procedures and clinical requirements. So total of 30 divided by 3 and it is.
File na ಹಾಕ್ಬಿಟ್ಟು punch ಮಾಡಿ.
So totally this is marks to be calculated for 10 marks and sessional examination carried by 2 examinations carried by OSCE and DOP. So that is direct observer practical.
ನಾವು ಓದ್ಬೇಕೆಲ್ಲ.
5 years. So
Okay,
that
ಇದು ಒಂದು
accounts for 30 marks divided by 2 and it will be marks for 15. So again 15 plus 10, 25. So how to conduct examination in the internship, that is in the 8th semester, that is the examination, internal examination is to be conducted for all 5 specialties, because 5 specialty postings are there. So that is in the 7th semester, 5 all 5 specialty postings need to be kept in divided the number of hours. So that 5 examinations, 5 specialty examinations need to be conducted, each for 10 marks, that comes to 50 marks. And OSCE in the form of OSCE. 5 specialty into 20 marks, that gives you marks for 100. University theory question paper pattern is given like this. So that each question paper is on 75 marks and has got 2 sections. Section A for 37 marks, section B for 38 marks. And the subdivisions are given like this: anatomy and physiology, section A for anatomy and B for physiology. So in the second subject, sociology, in the second section A, psychology in section B, microbiology in section A, infection control and safety in section B. Section A marks are given, questions, weightages are given here. That is MCQ, essay, short answer, and very short answers. So these are the marks in the question paper. And now this is the specification here. We need to stress out on this. In resolution itself is mentioned MCQ test. So in the second, in the other subjects also, nutrition, biochemistry has been made as section 1 and section 2. And here there are marks with differences. Section 1 biochemistry for 25 marks. Nutrition dietetics weightage is 50 marks. Pathology, pharmacology and genetics 38, 25 and 12 marks. And here research and statistics, research for 55 marks and statistics for 20 marks. And for other subjects, for 70 examinations are there for 75 marks, carries the question paper pattern like this: 12 marks into 1 question, 12, that is MCQ, 12 MCQs into 1 mark, 12, essay 2 into 15 marks, 30, short answers 5 questions into 5 marks, 25, very short answers 4 into 2 marks, 8. So totally you have a 75. So this is college examination pattern is given here. College examination. I'll list down what are the college examination subjects are. MCQ 8 into 1 marks. Essay 1 essay carries 10 marks for 10. Short essay 4 into 5 20. And the very short answer 6 into 2 12. University practical examinations are for 50 marks, OSCE 15, and direct observation in the practical sessions are for 35 marks. So in the third competency assessment, university examination, that is in the 8th semester, integrated OSCE including all specialty, station based, 5 specialties into 20 marks, that carries 100. The external 2 and internal
Okay,
3
okay.
examiners need to be present. That is external 2 examiners for the internal university practical examination in the internship. That is 2 external examiners from the different 2 specialities and internal 3 examination, one each from each specialty. So that 3 internals can be brought from the same institution or from the hospital, and 2 extra external examiners out of the university or of the institute. And they have to conduct examination for each student. So this is one of the specifications. And scheme of examination: first semester, communicative English, anatomy and physiology together one paper, sociology and psychology together one paper, nursing foundation practical. So here we will have 2 examinations, that is anatomy, physiology and sociology. Community English is the college examination, and nursing foundation is only internal. So that marks need to be carried forward to the second semester. So here applied biochemistry and applied nutrition and dietetics, nursing foundation 1 and 2, and health informatics and technology are 3 subjects placed in the second semester. 2 examination going subjects, and the third one is class examination, and 1 practical. Nursing foundation, that is of first and second semester together, was conducts examination at the end of second semester. And in the third semester, applied microbiology and infection control, including safety, pharmacology 1 and pathology 1, adult nursing, adult health nursing 1. So out of this, pharmacology 1 and pathology 1 will carry only internal examination from here, and the examination will be conducted in the end semester, that is 4th semester. So here 2 examinations and 1 practical examination. And 4th semester, pharmacology, pathology and genetics 1 and 2 from semester 3 and 4 will be conducted here for 70 credits. Adult health nursing 1, professionalism, ethics and professional values, that's class examination. So totally 2 examinations in the 4th semester and practical examination adult health nursing 2. 5th semester, child health nursing, mental health nursing, community health nursing 1, educational technology, introduction to forensic nursing and India laws. Those 2 are out of which the introduction to forensic nursing is the class examination. So here, child health nursing, mental health nursing will carry forward examinations, and totally there are 2 theory papers, a university examination papers and 1 class examination. And there are 1 practical examination and 2 practical exams are end semester examination, carried forward to the 6th semester. In the 6th semester, child health nursing, mental health nursing are the 2 papers brought from the previous semester, and a continuation examination, that is of 5th and 6th semester together. And nursing management and leadership, midwifery, obstetrics and gynecological nursing. So these are the 4 subject examinations, 1 only internal examination, midwifery, and nursing management and leadership. Other 2 subjects are having examination here. And practical examination for child health, mental health and OBG. Community health in the 7th semester, community health nursing 2, nursing research and statistics, midwifery and midwifery, obstetric gynecological nursing will have 3 examinations in 7th semester. Community health nursing 2, OBG nursing 1 and 2 will have practical examination. So in the semester 8, that is internship, competency based examination, as I have already told you, that is end semester examination. So university examination is combination of 5 examiners from different specialty will conduct examination for 20 marks each specialty, comprised of 5 examinations. So here there are no theory in the 7th and 8th semester. So a theory examination, theory practical examinations in the 7th semester. So here in the summary, I'll tell you, first semester there are 2 exams, second 2, third semester 2, 4th semester 2, fifth semester to sixth, seventh, 3 each, and eighth semester only competency. So practical wise, nursing foundation will have one examination at the end of second semester. And adult health nursing will have 2 examinations, one in third and fourth, another one in fourth semester. And community health nursing will be there in the fifth and seventh semester. Child health nursing, mental health nursing in sixth semester. Community and OPG in the seventh, and all specialty in seventh. So presently, the medical surgical nursing was kept in second year and fourth year. So in the revised syllabus, it has reduced considerably to only 1 year, that is in the third and fourth semester. So 2 examinations, others will have only 1 each exam. So these are the gradings. 0 is for fail, 4 for pass, 5 for average, 6 for above average, 7 is B plus, good, 8 A, very good, 9 is A plus, excellent, and 10th is outstanding. So here this one need to be very cautiously observed, and this is called SGPA. Totally, this is how the credit based evaluation system is called as. So this there are courses. Total number SGPA calculated is the weightage of average of grade points obtained in all the courses by the student during the semester. That is how many courses are there. That is subjects. Courses means subject. Credits. The total credits given for each one. Theory 3, 4, 3. Letter grades. If suppose a student carried A, B plus B, then the grade point will become 8, 7, and 6. So this will be multiplied 8 into 3, 24. So this is 24, 28, and 80. So SC page will be carried out. So like this, totally it 24, 28, and 80 becomes 70, and divided by total marks C1, C2, and C3. That is 6 plus 4, 10. So totally it is of 7 SGP. SGPA will be taken here. That is to calculate CGPA. CGPA is calculated with SGPA of all the semesters to 2 decimal point. I think Dr. Ramesh Sharma can very well explain about the CGPA and SGPA because they are following the system since years. So this is the way of calculation. This semester 1, 2, 3, 4 till the end of the semester. The total CGPA credits, that is each credit, this is given here. It is not obtained. It's in the prescribed credits, 20 credits in the first year, 20 credits in the second year. So this CGPA is obtained, so calculated from this formula for individual student. That is CSGPA. So that first semester credit, total credit into SGPA of the obtained by the student. So then into the second semester and obtained SGPA, third semester credit into obtained SGPA plus, so here third semester, fourth semester. Similarly for 5th, 6th, 7th, 8th. So totally it becomes a sum like this and divided by, so that is total credits, and that gives you a marks. So that is some decimal less than 10. So that is CGPA. So this is all about the highlights of the revised curriculum prescribed by Indian Nursing Council. So over to Prakash.
Yes, sir. Thank you for presenting overview about the revised syllabus given by the Indian Nursing Council. Definitely, sir, it will help for the audience to understand about the subject distribution and in various semester and scheme of examination, how we can implement in upcoming durations like that, or what kind of like that we need to preparation from our side and institution sides, it will definitely help for the audience participants also. Now we will proceed for next discussion I want to discuss call to Madam Dr. Larissa Martha ma'am, Sams ma'am. Please, ma'am, I want to just seek the explanation regarding the focal differences between old and revised BSc nursing curriculum. Ma'am, please. Dr. Larissa Martha, ma'am, please.
Yes, yes. You are able to see the screen?
No, ma'am, no, not. It's under started sharing. We need to wait. Ma'am, maybe need to click on some windows like the share screen.
Showing as your screen sharing is paused. I don't know why.
Ma'am, I just here showing has started screen sharing.
Yeah, but it's showing as paused.
Maybe we need to stop again and share.
Thanks. Can you please share? I have sent it.
Yes, ma'am. Yes, ma'am.
Good morning to all the panelists and all the audience. Before I could the slides could be shared. I would just like to highlight before this semester-wise syllabus could be brought out by the Indian Nursing Council. I think there were nearly 8 to 10 discussions with various experts that took place, whether to have the semester system or to continue with the annual system of examination, which is what currently being followed throughout the country, except for a few universities here and there. There was vehemently a lot of agreement that semester system should be followed, with few opposition as why annual system should be continued. Because when it comes to the deemed and the private universities, it becomes a lot more easier to implement the semester system. But when it comes to the state universities, it becomes a little more difficult to implement the annual system, semester system. That was the opinion expressed. But with the various discussions that took place with the UGC guidelines that if you want to adopt the credit-based system, one has to implement the semester system. Without that, the credit-based system cannot be implemented at all, which is what makes us one par with the other system of education that is being followed in the country. And even with the introduction of national education policy, it becomes very important that the semester system need to be incorporated. Even general education system also are involving the semester examinations. So in view of this, when you see the differences between the old and the current system of the curriculum that is being displayed by the Indian Nursing Council to be implemented by all the universities, that it becomes to see that what is the major differences that they are focusing on. One, the thrust that is mainly being given is the incorporation of technologies in implementing the professional education to the learners. The technological implementation becomes very important. One is the use of mainly the simulation lab for the practical training impartation. But when we see the realities, again, I would say for many of the private and deemed universities, it becomes a lot more easier to implement this. But when you see the ground realities across the countries, the practicum of introducing the simulation-based practicals is really a challenging task for various institutions. Then comes the choice by the learners, that is the electives. Introduction of electives is one of the major focus of this present curriculum. Then is a credit-based education system and competency-based education. There is a lot of doubt whether the previous curriculum was not a competency-based, and this how it is a competency-based education system. So when you see here, the learner is mainly given a task of mastering the practical knowledge in terms of the different levels. That is the first level, second level, and third level. That itself is a thrust that is given how a learner has to have the competency in terms of the particular procedures or the practical aspect. So these are the main highlights of this new curriculum to be implemented. When it comes to the old curriculum, the number of courses and the subjects are 23. But when it comes to the current, the revised curriculum, it is 30. So you can see the number of courses are increased. But when you see what is the component, maybe a minor changes are there, but numbers have been increased because some subjects have been bifurcated. Basic subjects were in condensed form with many not so related areas to nursing in the old curriculum. And the basic subjects have modified into an applied form. Again, I would say there is a lot of misgiving among so many people. Can it be called applied? Only by adding the word applied, can it become applied? In this context, I would really like to say it comes in part of implementation, because the basic subjects remain the basic. Only the application part, how a faculty or a teacher implements into the learner is what makes it applied. So that is why the faculty have a lot of role to mold themselves into these application aspects. And it was an annual pattern where it was 4 years in the old, whereas now it is semester system with 8 semesters, with one semester exclusively for the internship, and modules which have been made mandatory and electives. And old curriculum credit system is not followed, only the number of hours are followed, whereas here you are having the course credits of total 156 course credits are there, and courses are 141. That is, theory it is 90, and in terms of the learning it is 15, and then in terms of the practical aspect it is 36, and internship it is 12, and electives it is 3. And 20 hours of theory is considered as 1 credit hours, as already Dr. Ravindra said, and 40 lab hours are considered as 1 credit hours, and 80 clinical hours are considered as 1 credit. This is a standard based. There is nothing that newly it has been invented or innovations it is. And when you see the old curriculum in terms of the skill lab, which is mentioned but not made mandatory. But whereas here it is skill lab training is mandatory. So in case an institution doesn't have the skill lab in their own premises, definitely the learner needs to have acquaintance with the use of the skill lab for practical purposes by getting attached to any other institution nearby, having a well furnished and with a good simulators skill labs. And 63.78% of hours are allotted to the clinicals in the old curriculum. But whereas in the new curriculum, it is 71.59% are allotted to the lab as well as the clinicals. Because many comments I keep on hearing saying that it is theory loaded curriculum. See, we cannot remove the theory. We have to mention the subjects. In case the subjects are not mentioned, the topics are not mentioned, then again, there will be a argument saying that these topics are not included at all. Because we nursing professionals, we have seen, we want everything in black and white, written very specifically. So, but when you see, it is not a theory loaded curriculum, but it is a, where 71, that means nearly more than 29% are only given for the theoretical aspect. Old curriculum, the logbook, it is present to complete the procedures. Whereas in the revised curriculum, the logbook enforces competency to check by 3 levels, as already I said, level 1, 2, and 3. Only when the level 3 is mastered by the learner, the logbook entry could be done by the concerned teachers. An internal assessment was existing in the old curriculum. It was by the total mark by combining the various tasks, including the sessionals, without a due weightage. So the weightage were varying across the institutions, across the universities in the state, as well as in the country. But whereas here, there is a continuous assessment of 10 marks and sessional exams of 15 marks. So you cannot change that. So whichever universities or the state you go, this weightage remains the same. And practical exams, OSCE is mandatory. OSCE in the true sense, it needs to be done, not in the sense of OSCE just by mentioning the name. And grading the performance by absolute grading as given by the UGC, because all courses C grade will be considered as 50% and above, and for the non-university and electives, the G grade, that is 40% and above, will be considered the pass criteria. Only internship postings were there in the previous curriculum, it was there, but whereas here, you are having a competency assessment in the internship period. All the 5 specialities are having the competency assessment by 5 subject experts. So that is really an highlight. Again, the question comes, why wait till the 8th semester to assess the competency? So it is not at the 8th semester the competency is assessed in this new syllabus. Every semester the competence is assessed, but the cumulative competencies are assessed also in the 8th semester, which was not being done currently. The transcript in the old curriculum has not been specified, whereas there is a specification of transcript in the revised new curriculum also. And mainly the shifting role of the instructors. The teacher cannot just take a piece of paper and go to the class and give a lecture and come. No, definitely no. Definitely, there needs to be a shift in the role of the instructor in the new curriculum compared to the old one. because not because it's a semester system, not because there are some modules. It is just because the modality of delivering the curriculum itself has been really remodified because it is a competency based. The teacher should see that the learner develop the competency in the particular areas. If the student doesn't develop the competencies, definitely the curriculum cannot become an effective one. So the teacher has a lot role here. And when it comes to the aspect of the teacher in terms of molding the students because of the grading system, again the role of the teacher is enhanced here compared to the old curriculum. So the teacher needs to pace at the level of the students, taking extra effort so that the true CBL takes place. Competency based is not definitely an easy task at all. So it really requires more effort from the teacher's side also. So that is what in holistical I should say the difference between the old and the new curriculum. Thank you.
Thank you, ma'am. Thank you for giving about the basic differences. As per ma'am, generally we can say like that if we adapt this curriculum in that condition, teacher must require a competency and then need to emphasis on clinical practice as well as theory. We never ignore like that clinical practice is subside things, or we can emphasis on theory only. We can say we already previously discussed about same subject only. Generally, we can say like that all subjects are distributed in semester system, but additionally we add the module system or competency like the clean for enhance the clinical practice, or that is really good thing to enhance or improve the standard of students, also standard of the profession. Also it will help to improve the or other practices that are using in clinical area like that during the nursing care, each and everything it will. Or we can say like that normally so many years has been gone to change the syllabus like that. We heard about our seniors, and seniors also dealing with the same patterns also. But when we ask to someone else, okay, what do you read in your BSc nursing or MSc nursing or seniors or super seniors, in that condition they may reply, okay, whatever you read, we also read the same, we gone through the same pattern only. That is not a new change. So now also time and generation also change, or technology also change, and pattern modern modalities also change. So that is a very good things key you need to change something like that. Thank you, ma'am. Thank you for giving your opinion. Next we come on Dr. Sudha Reddy, ma'am. Ma'am, are you ready? Ma'am, I want to just know from your side what are the basic advantage if we adopt the semester system in any program like that. We can say BSc nursing, if we adopt, then what is the basic advantage for a student, what is the basic advantage for teachers, what is the basic advantage for academician, administrator, also leaders also. So ma'am, please.
Thank you, Dr. Devraj. Before I discuss this, because I'm not portraying any slides, it's just a discussion. I would like to thank Dr. Larissa for such an explicit explanation. I mean, she's known for that. That is why she's where she is. So beautifully, she's explained what was previously not there and what is there now. I just wanted to add up now. They have this, what we used to already do, cumulative records. We used to see the procedures in the clinics. Now it is called technically DOPS, direct observation of procedural skills. So this mini CX or mini clinical examinations, all these new things which we used to do in our university, OSCEs we were doing, but now council's syllabus has stated it is good. The only challenge here would be having a lot of examiners, internal and external examiners, and training them. See why some of the deemed universities did not implement OSCE, OSPE in the final exam was because the examiners from the state universities who come are not trained in OSCE, OSPE. So we just did it at the institutional level. Now everybody across deemed university, state university have to get trained for this new syllabus, which is universally rolled across India. And it's a welcome for some of us, some of the academicians like us. It's a very welcome thing. Like I personally am very happy that this semester system has come into nursing, because we have been seeing it in our fellow engineering college syllabus, pharmacy college syllabuses, and how well the course goes on. If you look at the syllabus which has come up now, the semester system, which is credit based, which is choice based only for the elective course, and basically a competency based curriculum. It brings lot of learning experiences and challenges both for the students, teachers, and above them for the administrators. So I was thinking, how do I say things? But Devraj said, Madam, please tell students के लिए कैसे, teachers के लिए कैसे, administrators के लिए कैसे. मुझे अच्छा हो गया थोड़ा categorize करके बोलने के लिए. Advantages अगर आप students के लिए देखेंगे तो एक online मतलब continuous learning environment and feedback students are going to get from this, because previously it was a year-long system with 6 months they used to be in the college, which they will of course now be there for some hours. But the whole day, whole year, the teaching used to go on. Teachers used to come. Then if they are doing their PhDs, they will take a long leave and go 7, 8 of them doing PhDs. Then the students are stuck. Then a new teacher takes. But now in this short half yearly way of doing things, there will be a continuous learning environment and continuous feedback. And students, of course, will not have the whole burden, because I have seen my own son being an engineering student in the semester kind of system in engineering college. They study the first semester, the subjects, they forget about it in the second semester. This is, I'm talking from the student's point of view. If they are happy कि हो गया हमारा एक semester, we are never going to study these subjects again. So then in the next semester, they only delimit themselves to that semester of the second half of the first semester, and those exams are over. And the same way our students will be having less burden, because they will think ki, this applied anat physio, which are very difficult subjects for them otherwise psychologically. Then presentation so sorry for the disturbance. So they like they don't have to read those subjects again. They'll be more focused on learning those applied anat and physio in the first semester, and then they forget it. And nursing may we need only applied anat and applied physio. We had seen the last syllabus, the whole year anat physio used to go on, and there was a lot of disparity among marking them or grading them, because like if we are attached to a medical college, they used to fail half of our students in anat physio, until 4th year they were going on appearing for the same exams. But now I'm happy that in this semester kind of system where you have more of applied anatomy, applied physiology, applied micro, applied bio, more importance to nutrition. This is the plus point I see for the beginners in nursing who feel all these subjects are very tough. The second thing is that we are going to not have any bias about a student, because 2 times we will see the sessional results and be able to assess and reassess and change our mind about some weak students. क्योंकि वो एक साल में 2 subject में fail हो गया, तो पूरे साल we keep telling अरे that student is not good. They come in the category of slow learners. But now we will have a chance to change our mindset and our biasness about such students, because definitely they will improve in the second semester exam as compared to first semester. And in nursing, most of all, where we have 100 students, managing them, even though having our own parent hospital across the road, that is just across the college, there's a lot of incidents of absenteeism, because huge number of beds, 2,400 beds. I'm just giving example of mine, different wards, कहाँ से जाते हैं, कहाँ से गायब होते. It was so difficult to monitor. But now the absenteeism can be reduced, because there is a lot of importance given to percentage of attendance even in the formative assessment. So that's one thing I'm glad which has come. We used to control them, but now it is there from the council. It's a very good thing which has happened. And semester system always focuses on regular study habits. They just focus on those things. They know ki they're very happy ki we have communicative. If I was a student, I would feel ठीक है, communicative English है, वो एक मेरा internal है, और anat physio और foundations. तो we focus कि कितने internal हैं और कितने external हैं, and we prepare ourselves to study in the similar manner. And teacher student interaction is increased, because that same teacher जो एक साल में पूरे साल में कभी कभी आता था, because they divide the units. Now continuously those 2-3 teachers will be there for the students for the same session, and they will personally know them, mentor them, and identify these slow learners and see that they get equipped with classes and take use of the advanced learners to also help mentoring these slow learners. So that cycle will decrease and it will be more impactful. And there is a lot of flexibility in the syllabus, and you have the choice based, you have the elective courses which they can choose, which I feel that in deemed university like ours, we always saw to it that okay, value added add-on courses, organ transplant nursing, palliative care nursing, lactational consultants, respectful maternity care, we made all of them do for every year depending upon the syllabus in which year it was covered. But now they have to choose only one out of many. So that will decrease the headache of theirs also and also of the teachers. एंड उनको सेमेस्टर ब्रेक मिलेगा अगर यूनिवर्सिटी डिसाइड्स कि एक सेमेस्टर के बाद इतनी छुट्टियां, फिर एक सेमेस्टर के बाद इतनी छुट्टियां, they'll be very happy कि we'll study, we'll go back and then we'll come back. And the grading system is good. We still need to learn about it because we are the beginners. We are not like some of you who are already doing it. The grading system will not make them feel कि हाँ हम बहुत weak हैं या हम बहुत poor हैं. Like it's good for the student side. And I have seen in engineering students also that they have this, they all have their own pace of learning. And when they finish, they may go one semester aage, they may have some backlog subjects, they may clear them, but they are never discriminated as weak students and strong students. That is the beauty of this system. And we have more focused and measurable outcomes here. For teachers, it may be a little stressful because they can't take leave as they wanted. पहले तो सब ऐसे exams के लिए चले जाते थे, like teachers. I'm talking very practically, which we all may face, which we face. They used to go for other university exams. They used to go for their pre-PhD classes. They used to go for their personal leaves. But I have seen in semester system, they cannot do that. They have to complete their portions and then go. So teachers will have to be more accountable, and the responsibility of taking clinicals, taking lab classes, taking classroom classes, assigning, searching for preceptors in the hospital. Like now INC has given permission that senior nurses who are there can take part in evaluating the logbooks, which is a very welcome step, which of course we were doing under a British Council collaboration. We learned something called collaborative learning in practice, where we used to use staff nurses to assess the logbook. So that has come in. So that's something very welcome, because a diploma senior nurse may be much more skillful than me in a labor room and able to assess the students' monitoring of labor better than me as a principal who is also an OBG person. So these things will give more empowerment to those nurses also to participate in the college program. And this will help reduce the gap between nursing education and practice. And teachers will have to reskill themselves. All of us as teachers have lost our skills and art of nursing because we feel we are teachers. And in universally, I'm talking, it may not be everywhere, but teachers don't go to clinicals. And most of the colleges in my state have attachments to government hospitals where they go for 2 hours, 2 hours, 2 hours. It is divided. I don't know how are they going to manage the clinical delivery. But here, teachers will have to be in the clinicals. They will have to reskill their skills, because if they have to teach them in the labs on the simulation models, whether they are task trainers or they are mid or high level fidelity mannequins, the teachers have to train themselves. That is the biggest challenge here between the administrator and the students. You need skilled teachers. Agar teachers skilled nahi rahe, to kya padayenge? And it's going to be a very embarrassing situation, because medical college mein the medical principal or the medical superintendent, he operates, goes to OPD, take rounds, teaches. So that is the example they always give us and tell, tum log to aise karte nahi ho, tum college mein rehte ho, and all those things. I'm happy that this syllabus will slowly over the years bridge in the gap, and all the labs and the skill labs will be open. ताला खुल जाएगा. Inspection के time उतने ही वो नहीं खुलेंगे. ताला खुल जाएगा. You will utilize the labs, and you will have lab classes in your timetables. Some of us already have. So a lot of skill things will go on. So it's for me a very welcome step. There may be challenges for the university, like how to set the, see, now we have to have a new panel of examiners. We have to consider the OSCE, OSPI in mind, increase the number of internal and external examiners in our board of studies. We need to have a new question paper pattern, because the new question has come, another short answer thing, which was not there in many of our universities. And we will have to change the entire exam system, like softwares for exam marking, all that. And it will be a huge manpower requirement from the exam section also. So these are some of the things which I wanted to tell all of you. Ki challenges to rahenge, but we have to overcome the challenges. And as Larissa madam said, ऐसा नहीं था कि nursing was not a competency based syllabus. It has always been, but now they have specified it, and it is a warm welcome, keeping in mind all the principles of the new national education policy also. Thank you so much.
Thank you, ma'am, for giving the information. Really, it will help for the slow learner and advanced learner to improve their knowledge. Now, I would like to invite Dr. Anil Sharma, sir. Please, may I know about what is the basic impact of the semester system on examinations, sir, please?
Very good noon to all of you. First of all, let me congratulate Dr. Rabindu sir and his team for conducting this webinar, which is really in need of this time. And just before my talk, we have seen two influential teachers talk. They have very well explained in their 5 or 10-minute talk about that what is all about this syllabus, what is all about the new curriculum which is come up by the Indian Nursing Council. You know, but in our university, which is Charuttar University of Science and Technology, since 2009, we are offering the semester and grading system. And in 2015-16, we offered the choice-based credit system as well. So there are a lot of impact you will see of the semester system on the examination. Just Dr. Sudha said that it's impacting everyone, including administrators of your university or the institute, the teachers, and definitely the students. But I like to prefer more talking about the student side, because this current system is in more of the student centric, where the things are get changed and the students were the first preference, that if the system supposed to be in favor of the student. So that's how they have created. I just prepared 2 or 3 slides. If you can able to give, if you give me the hostship, then I'll able to share that. Am I allowed to share? Okay, is this visible?
Yes, sir, very well.
Okay. So let us see that examination system. So I'll take my talk straight away to the point table, which is given by the Indian Nursing Council, which is the grade point table. If you see this table has been given by the Indian Nursing Council. Now, if you see the similarities in this table along with the UGC, what the UGC preferred, actually their cap is of 5% instead of 10%, but INC kept it 10%. Now, what is the idea beyond this, keeping this table? Is this the student who are the table of, let us say, 50 to 59, those who are securing the C grade are of the similar level. In the marking system, even 1 mark is creating discrimination among the 2 topper student or 2 poorer student or 2 average student. But in the grading system, the people are kept in a group instead of keeping them individual 1-to-1. That's because, you know, there are a lot of biases happening. There are a lot of subjectivities happening during the evaluation time. So one of is very common, the teacher's mindset, the examiner mindset. If mind is good, then maybe 2 marks extra. If they are in the poor mindset, then maybe 1 mark less to the student or 2 marks less. So this system has been created where the student were clubbed in a group instead of giving them 1-1 marking. So let us say one student is getting 64 marks out of 100 and second is getting 68. Now both the students' caliber is same. That is an idea, that is a philosophy of keeping this grading system. So that's how the INC have given this credit and grading system. Now, if you see this table, the table is divided in 8 points, where the F considered is the failure, The P is only for 1 or 2 courses, for example, communicative English, where 40% is allowed. Then C onwards, all nursing, like how Ravindra sir have said in the beginning, the foundation and core course and the elective courses. These are the 3 pillars of any semester-based examination or semester-based curriculum, you can say. So all foundation and core courses need to be the students supposed to awarded C and above grades. If they have less than C grades, then they will be considered as a fail. So this table is very, very clear to all of us. Only the thing which is little doubt is that whether the student can able to achieve O grade or not, because O consider as an 100%. The UGC, of course, have given this that no one can able to achieve the O grade. So we have raised this. Let us see how it's going to be covered up by the Indian Nursing Council. But this is the table which we have at present. Now we will see that why it is student centric. I have an example further. This is a SGPA, semester grade point average, where we have seen the table, the sum of CIGI divided by the sum of CI. What is that? Where CI is the number of credit of course I. In the semester system, we say course as a subject. Subject को हम course कहते हैं यहाँ पे. Very simple. So all your credits of the courses, the sum of that, and GI is the grade point a student will get in the examination. Now, this system is actually a sandwich system. Why it is sandwich system? Because the student will write an examination and the teacher will assess those papers in the marking system. For example, student have written the examination and I am an evaluator, I am an examiner, then I'll give the marks. I'll not give the grades. Now, these marks based on the previous grade table will be converted into the grades. Let us say, if I take you in the previous, this table, let us say I have given to a student 65 marks, then those 65 marks will be converted to the B grade. Is this clear? Then this grade is considered as a GI here. So I is A to N, that is the all courses, and in the number of courses, that is a SGPA. Now, what is CGPA? CGPA is in cumulative, like all semesters will come together. So you will find the CGPA after first semester onward. In first semester, you will have only SGPA as an evaluation, and second semester onwards, because it has to cumulate. Second semester onwards, you will find the CGPA. That name is the cumulative grade point average. Now, I have an example here. I have taken intentionally the third semester courses, which is given by the Indian Nursing Council. If you see, there are 4 courses, and if you see the examination, then there are 3 papers. The pharmacology and pathology, they have clubbed together, and they kept one as an examination. So the course named as an applied microbiology and infection control, including safety, it has 2 credits allotted by the Indian Nursing Council. Pharmacology 1, pathology 1 has been given 1 credit, whereas the adult health nursing 1 with the integrated pathophysiology, including BCLS module, has been given 7 credits. Now, what is need to understand here? The student in the semester system will concentrate more on those courses, more on those subjects which have the higher credits, because they are proportionately increasing their point average. Now, how it is, I have given 2 scenarios. If you see the last table in the column, obtained grade, there are 2 tables are there, 2 columns are there. In first column, the courses which have the lower credits is being given the higher grades. Let us say in applied microbiology, 2 credit course, the student obtained grade is A+. A+ as per the point table, it is 9. Whereas in the pharmacology 1 and the pathology 1, again 1 credit, and the obtained grade is again very high, it is 9. Means they are achieving more than 90% in those courses. But a course which has the highest credit in that particular semester, that is the adult health nursing 1, which is 7 credit course. Now here student only awarded with the C grade. C grade means in between 50 to 59%. So 5 point. Now, if we will calculate our SGPA, then we will see 2 is the credit, 9 is the obtained grade. So 2 multiplied by 9 plus each course is going to be calculated similarly. We will find 71 will be the total divided by the sum of total credit of that particular semester. So total credit of that particular semester is 11. divided, so 71 divided by 11, you will find 6.45 is the SGPA of that particular student. In another example, we have seen like where the lower credit course are given the lower grades, but the course which have the high credit is being given good marks. For example, in the last column, if you see in the table, applied microbiology is given 5, like C grade for the 2 credits. In pharma and patho 1-1, we have D+ and A+ good credits, but the course which has the high credit is a 7, is being given the highest credit as a 9. Now, if you see that calculation, it is going to be ended by 8.09 SGPA. It shows that it is completely student centric, and the student can able to understand that where and how I can able to enhance my performance, my competency, so that I'll be able to secure the good grades. So that's how the system is completely student centric. The student can able to, it has a lot of transparency. This examination system has a lot of transparency because it's very clear for the students. Either it is in continuous and there is no chance of the lethargy from the student side and from teacher side. If you talk about the examination, because the continuous evaluation gives the credit to the teacher that you are going to evaluate the student on every day basis. And that's how the continuous evaluation concept have come up. So it's good that the Indian Nursing Council have taken up this project. And continuous evaluation, internal, your sectional marks or the group projects has been added. Earlier, it was not so structurally mentioned, but now it has there. So we have full freedom, like the teacher have full freedom to assess the student, and the weightage is very clear for the student from the beginning itself, that what amount of things they are evaluated by the teacher, and they are very clear about the credits, they are very clear about the grades. So they may able to calculate their own things, that how I'm going to perform so that I'm able to get good, or I'm able to secure the good SGPA and the CGPA. So I believe this system is completely student centric. Teachers have a lot of challenges here. So the first challenge is if you talk about the teacher side, then getting acquainted with the system, because credit and grading system is, it need little more concentration to understand. I'll share in our department how we do, because we understand all the faculties who have qualified from other universities, they don't offer the credit and grading system. So first job of our university and our institute is first make them understand. So we have a special team here in each institute. Those newly recruited faculties are getting acquainted by the awareness session on the grading and the evaluation system, and how we are going to execute the curriculum. So that's how overall we take it. That's all about from the examination side, I guess. Thank you, Devraj.
Thank you, sir. Really, it will helpful for the beginners who are new teacher and new experience with that system. Now, again, I want to ask from Dr. Larissa Martha ma'am about the ma'am is there. Dr. Larissa Martha ma'am, please may I know about the basic pros and cons of semester system. What is the pros and cons if we apply for that?
Yes, coming to the semester system and the annual system. So as already I have said, many prefer annual system because we people are always good in doing what we are already been doing for so many years. Some change, there is always a resistance. So same thing with regard to the semester system also. So if I have to say, what is the semester system? Why do you need to do that? So in that case, when you see about that semester system, whether it is necessary or not. So many people, when I ask with them, how do you feel about the semester system? So they said that, yes, it is good, it is bad. So what is good? One thing is that students will have to slog less because they have to study less in one semester compared to the annual system. So as the previous speaker has already said that it's student-friendly method. Yes, even the semester system also, one way it's a student-friendly method. And there are more focused class, lab and clinical interaction between the teacher and the student continuously. which makes the student always be alert. Not that at the last minute I will get up and then I will study, then I can master the things. So it's a continuous process. It keeps the student's study habits alive all throughout. And it will synchronize the undergraduate studies with the postgraduate courses, because when you do these sort of studies, the postgraduate course where you are morely focusing on self-study becomes very important. Then students will have to slog less, as they will have to study less things, and there will be more focused interaction with the teachers also. So teachers also will have to focus less things. That is one main aspect that we need to think about. Another thing is that opportunity for self-assessment, learning and feedback for the students. So when you are already ongoing things happening, the self-assessment keeps happening. So the students also can improvise themselves at the earliest than waiting for the last minute. And students can avail better understanding of the subjects because they have few subjects to study in a semester, and higher classroom interaction and engagement between the teacher and the students, and promoting evaluation of the performance of students twice a year will also enhance their performance, and less burden of the syllabus to some extent because they are divided into two halves. Yes, I think in the beginning somebody said that the subject has been divided into 2 semesters, maybe we may have to do in 1 year. If I have to say that practically when the syllabus formation was discussed, it was thought that it will be given in 1 semester itself, maybe 2 subjects in 1 semester. But the practical problem across the country is that before 2016, it is not mandatory that the institution need to have the parent hospital compulsorily. Most of for the specialty subjects like pediatrics, psychiatry, they are going for an affiliated hospital. So in a 6 months, or I should say 5 months, they may not be able to get the permission for all the students posting in the clinical area. So that is only the one reason why the subject is spread across 2 semesters. Otherwise, it would have been in 1 semester itself. So that is why the students forgetting may be a problem when you have this method in this semester system for this new curriculum. At the same time, the development of the skills with regard to the subjects can be in a very better way also. That is one positive way of looking at things. And when it comes to the negative aspects, what are the negative aspects, or you say the cons when you say that? Students have to manage the syllabus in a short time. One thing is that they can finish it. Another thing is that they have to manage. So as Dr. Sudha was telling, the faculty may not be able to take leave. Same thing applies to the students also. They can also not become absent for a long time, which otherwise keeps on happening. So they need to be very alert. Otherwise they lose their attendance. They may not be eligible to appear for the examination. So that's another thing. Sometimes the teacher cannot convey the whole knowledge of the subjects in a short time also. That competency some teachers may not have, which they may have to develop. So delivering, many times I have observed that a small topics, the teacher is unable to finish in 20 minutes or 30 minutes. They say, how the students will understand? It is very difficult. They are not understanding. So they may take 1 hour or even sometimes 2 hours, which may not be possible. Because we need to inculcate the reading habit among the students, not presenting everything in the classroom lecture method. So that time the teachers may find it very difficult. There is less time for research. Students do not get enough opportunity to research because it's a short span of time. Next examination is ready. So the research, I feel personally also may take little back seat, and time passes very quickly. By the time you look, 1 semester is over, you are already ready for an examination. So it does not let some students have complete knowledge about the subjects. By the time they become serious and start becoming learning, already the 3 months have passed. So that is one more thing, a negative thing. And will not give the students the opportunity to develop perspective, as there will be no time for the extra reading also. That is one more way of looking at things. And semester system, the students may not have ability for co-curricular activities. Even now, COVID time, I think many of the students are complaining, we don't have any co-curricular activities, cultural programs, all those things. But when it comes to semester system, managing the academic with the co-curricular will be really a challenging task. Then administrative infrastructure development for a semester system need to be very strong. Otherwise, the institution will have a lot of problems. Students from underprivileged backgrounds will suffer as they take longer to get acquainted with the system because they are little slow learners in some of the occasions. So for them, it may be a slight disadvantage maybe in the initial years. Maybe by the time they come to the third and fourth semester, they may be able to grasp. And not having enough time even for the faculty for the research activities, because they also will be consumed with the students all the time in the lab with clinical hours, then conducting examinations, evaluation. So all these things will be the more focus of the teachers. So you have both the advantages and disadvantages, but it is difficult to decide whether semester system is best or annual system is best or not. But if you review the students' choice, most of them prefer semester system over the annual system because most of them try to finish and get it over, then go to the next level of learning. So in that way, it is student-friendly aspect. But as a teacher, one needs to balance how to make the semester system effective. At the same time, the learning takes place at the clinical side as well as the theoretical aspect. Thank you.
Thank you, ma'am. Thank you. As per ma'am, we can say like that it will be little challengeable for student and teacher both.
Yes.
Yeah, they both are need to be alert regarding the progress of the syllabus, and the student also need to be alert regarding their self growth also, exams and all. Thank you, ma'am. Thank you. Now, I would like to again come to Dr. Sudha Reddy, ma'am. Yeah. Yes, ma'am. Ma'am, I know something challenges for the nursing administrator like that as a principal, dean, which kind of challenges they may be faced during the implementation of semester system at university level. We can say university administered, deemed university or private state universities, they autonomous board.
Yeah, thank you for the question. Definitely, it is going to be a challenge at the university level. Let me talk first about the deemed to be university levels, and then we will discuss the huge ocean of state level universities. If you look at the deemed university level, till now we were used to having annual pattern of examination system, moderation of papers annually, sending them to external examiners, and then we had stored question banks. Everything was fine for us, but to have it semester wise, subject wise, getting a new set of question bank repeatedly will be a big challenge. And I don't know how we are going to tackle this, because getting a list of new panel of examiners is always challenging. To follow up, someone has retired, someone has expired, someone is eligible who was 3 years less, now they have become eligible, and to contact such people from our other universities and updating will be a big challenge, because you need a set of examiners for every semester, and some of them would be repeated because of the general subjects and the subject specialty. And then the problem of scanning the question papers, because in our university everything is digital, the evaluation, the selection of question paper just coming 15 minutes back for the printing. So it's all very software operated. We use continuous software for it. So that will be even more challenging, because दो बार एग्जाम होंगे, two times exams, two times scanning 100 बच्चों के question papers, answer sheets will be a big challenge. And then the number of examiners to be selected for paper evaluation and also for the practical examination, especially to train them in OSCE, OSPI will be challenging. Plus, if you look at the internship, where they say कि 5 subjects का cumulative exam है, so they need 5 tables of 5 subjects with 5 internal and then how many external. So this is all going to be very challenging. And the remunerations, like some of them may refuse to come, ki we will not come for such less remuneration. Then will the university every time approve the increased remuneration for this more challenging work? These are the exam specific, the university exam section specific work, and we usually do the shredding of the answer sheets after a particular period of time. Now this semester system में इतने sets को कहाँ store करके रखेंगे? I mean, because you just suddenly can't shred them. We do have a shredder machine there, but then we don't have huge storerooms to store all these exam papers for a long time. And then the most interesting problem which I feel here is, like, in engineering colleges, Anil must be knowing unke semester system mein, what happens is, like, suppose I appear for one semester exam, the first semester exam, and I get very marginal marks in some subjects, then they have immediately within 10-15 days makeup exams. This is a pattern which happens in engineering colleges. So wo jo thode se exam se, they don't declare them as fail, that is why those students itne bindas घूमते फिरते हैं 6-7 साल में इंजीनियरिंग करते, बिकॉज उनको वो एक स्टिग्मा नहीं है कि वो लोग पुअर स्टूडेंट्स हैं या दे आर फेल, ऐसे है ही नहीं मतलब. And they make so much money once they come out of engineering colleges and settle down in life, because that complex is never given to them. Whereas in nursing, already we are like stigmatized, oh, these are nursing students. Uske upar aise exam system mein, if you don't look for a solution right now, because ek to they do makeup exam where they fail with just less marks, and immediately the results are declared and they go to the second semester. Here we call them instantaneous exams, which they do in pharmacy. So which they don't do for us, because our annual system tha, so we had that 6 monthly supplementary and all that. The other challenge is that एक बार makeup exam हो जाता है इनका, and they go to the second semester, and then in first year if they have failed in 4 subjects and they have cleared 2 subjects with this makeup exams, then the other 2 subjects they will do as fast track exams. So every even semester has a fast track exam where they clear this previous backlog and they go on, So I mean, nursing, maybe we will have to think about this thing, because supplementary exams will be a big challenge. So that's one thing, and it should be more, even the evaluation system should be more student friendly, na? Because students को अगर हम उतना scope नहीं देंगे, they will not be happy with the whole system, because teaching, learning and evaluation go side by side. And that is one challenge which the students will face. As an administrator, I also feel loans का क्या होगा, मतलब we have fees to give annual fee structure for loans for students from different states, scholarships. So we will have to look at the engineering colleges or pharmacy colleges, how they tackle this. For me, it is new now. And if you look at this is only the problem of deemed to be universities who have just 5 or 6 or 9 colleges with them, like nursing, physiotherapy, pharma. Think about the state level health sciences universities across India, across the states. हमारे यहाँ राजीव गांधी है, and Maharashtra में MUHS है. What happens to them? And कितने सारे colleges हैं, and I don't know how are they going to deal with this. It is really going to be a very tough challenge. But then I just want to tell them not to lose hope, because we have the Vishweshraya Technical University, which is an engineering university for all the engineering colleges in the state in Belgaum. So how they manage their state-wise, तो हर problem का solution है, but these are the administrative challenges which definitely we will face. Thank you. And one more thing I wanted to add, like Anil was saying, वो grading system UGC का O+ तक. Recently in some deemed universities board of studies meeting like Enapoya, Nitte, we discussed, very aptly they have removed that O in their own board of studies and their academic council. They said nursing में तो किसी को 100 out of 100 मिलता ही नहीं है, so they have done that. So that can also be done at the state level, and I think INC should definitely give some guidelines to follow for that. Otherwise, in every other way, the INC syllabus, the pattern of teaching learning is also specified. I mean, in INC, we are so much spoon-fed. When we discuss our INC syllabus with the medical colleagues, yesterday also we were discussing, they tell, madam, you don't have to worry, aapka to sab itna specified hai. Everything is clearly told ki which topic has to be done by role play, which topic has to be done by simulation. Because, we were talking about when NAC is there, all teaching, learning, innovative methods, BBLOs, flipped classrooms will come later to that. How do we record them? Because teachers don't listen, na? Kitna bhi bolo, like they have their own difficulties. And So that time they were telling, ma'am, yours though no problem. Everything is specified in INC. So just out of the box, out of the context, I was thinking now every college we have those photography club, this club, that club, trekkers club. We should have a theatrics club or a drama club in the college where you have those good teachers who are good in acting and that group of students from SNA, because we have to teach role play, we have to teach simulation. So that will be one very innovative thing which all of us can adopt to fulfill the requirements of this new syllabus. Thank you.
Thank you, ma'am. Thank you so much regarding speaking the challenges. Administration. Mainly, we can say like the main challenges is for administrator is like the conducting exam, or there is no space for a special bake exam. Like that, we can say it will be more challenge for students like that. They need to wait for 6 months upcoming exam, next semester exam. Also in engineering, also a special bake exam for them where we attend. Thank you, ma'am. And now we come to Dr. Anil Sharma, sir. Sir, I want, yes, sir, Dr. Anil Sharma, sir.
Yes, sir, please, I'm there.
Yeah, sir, I want to hear from you like that. What are the basic difficulties for teachers? Like that, some are junior teachers, some are new teachers. They have maybe newly experienced about their semester here, semester system. So, what's your opinion, sir? Please say.
Thank you for the question, but let us consider as the challenges instead of difficulties. We will have a lot of challenges. I remember when I joined here this university in the semester and grading system, I remembered one of my teachers' quote during my study. She was used to say, "Anil, I'll give you a lot of oxygen, but I'll not allow you to inhale it." So this semester system is similarly, it's going to keep us, all the teachers on their toes. It's very congested. Congested means you have a lot of work to do. There are lots and means you have to understand the earlier we were used to do it in the annual system, the work which is completed in an year. Now you need to complete that work in a semester. Though the proportion of that work may be little less, but the amount of exercise you need to prepare that work is almost similar. So you consider this is very challenging for the teachers because they need to do all the planning, everything they have to done. And what Dr. Sudha said, just similar, like examination, if you consider earlier, they were used to write, conducting examination once in a month, in an year. But now it's almost 4 to 5 months in an year. The reason being, twice you will face the university examination, then you will face the supplementary examination. Internals are ongoing. Then conducting examination, evaluating those, you need a lot of time. Then when you will going to execute the teaching plans, that's another. Now for the co-curricular, definitely the teachers has to play a major role here. Means there is no time for the leaves, for the teachers, for the student. And we are seeing here since long that the teachers really doing work hard to match with the quality education. And if you wanted to have the quality education, definitely you need a lot of planning. It's a meticulous planning you need to cover up and prepare your teacher. Definitely we are going to face initially for an year, 2 years to acquaint our teachers in this system, because we all have studied in an annual system where the marking was in supreme authority. Then again, when switching to a new system of the semester, and that is also in the credit and grading system, your teachers need to understand it very well, because till teacher will not have the clarity, they'll not able to, guide your student, they'll not able to mentor the student. One of the problem what we are seeing in this, that the teachers, once they're trying to make a good relationship with the student, by the time they'll prepare a good relationship, the semester switches. So it's hardly you will get 3 months of time to see. And that's the reason UGC even said that 90 working days you must have in a semester. So 90 days, you will find, then you have to make it a priority what you need to do. Whether you wanted to give the content to your student, you wanted to make it a pedagogy offering or an andragogy. Here again, the educational things will come up. So at higher education, definitely at the postgraduate level, this is very successful method, where you can promote the self-learning in a better way. But at the UG level, definitely the teachers are facing lots and lots of challenges. And there is no list of those challenges. You will see that either it is in practical, clinical, or else you will find it in the theory block. You will find your teachers will be on toe. They have no time for preparing the other things. Co-curricular and extracurricular sports, forget about it. It's going to be like this, but I don't want to make you afraid because we are doing it successfully since last 11 years. What Dr. Sudha ma'am said just now, Vishwasharya University or the technical universities, they are doing it. We are the self-finance university, state private university, but the amount of work we have is almost similar. In the bigger university or public university, you will have a panel to adjust the things. Here you will have a smaller panel comparatively. But yes, it is at you need the teachers' flexibility to adjust with the system. But yes, teachers are going to face, even in the clinical, you will see that a lot of this module-based teaching. So how you are going to create those modules? Well, now INC said they are going to provide those modules, but I'm not in favor of getting everything as spoon-feeded. So let your teachers work hard on that. Now, at the same time, we are talking about the outcome-based education. So when we are saying the outcome-based education, what your teachers will do? Either they are going to execute more on the planning side or more on the execution side. So that need smart work comparatively the hard work, where the teachers need to match with the challenges of the semester system. And there is a lot to talk about, but I don't think that in 10-15 minutes we may be able to match up with all the challenges. But yes, it's going to be challenging, but it's going to be a good entertainment for the teachers to understand, to play with their own expertise. Yeah, thank you, Devrajji.
Thank you, sir.
If you have
Thank
any
you.
specific questions, we may be able to answer.
Yeah, thank you, sir. Generally, we can say like that ki there is an interaction phase or little time for working phase only, direct termination phase. Yeah, working phase is very limited for teachers like that. Within the short span, they need to be cover overall things, that may be exam, internal evaluation, that may be related to subject or content. Okay, thank you, sir. I want to ask from Dr. Sudha ma'am.
Yes.
Yeah, ma'am. In a semester system, generally, if we go through the curriculum or if we go through the guideline, then there will be stressed on experiential learning and blended learning. So, may I know about something about blended learning and experiential learning?
Yeah, thank you. Both of them are different teaching learning technologies. And we have been doing experiential learning in nursing, but we had not labeled it like this. Experiential learning is nothing but learning by doing and reflecting on it. Like when we were small kids, they used to take us to a zoo for a trip, then we used to go, we used to see the wild animals. I remember the other day when I went to Jaipur, Maharaja Global University for a while, then we went to that zoo, which I'd never been to. So we saw, and then we reflect, I say, this is a white tiger. So same way, when we go to the labor room, initially they tell us to observe certain deliveries, normal deliveries. Then they tell us to assist in some normal deliveries and then to conduct normal deliveries. When we learn to give an IM or IV injection, पहले हम observe करते हैं, पहले हम पढ़ते हैं, then we observe our teacher demonstrating it to us, then we try to re-demonstrate, then do it many times. Reflect with the mistakes. Last time जब मैंने इंजेक्शन दिया तो पेशेंट को बहुत पेन हुआ, मतलब ना इस बार नहीं हुआ, तो we know कौन सा एंगल कैसे. So it is learning by doing and with lot of reflections on it कि कहाँ गलत हुए हम. So that is a very new thing in this syllabus, and whoever appear for Intellects RN, they have this critical thinking questions and reflective learning. They train them on this. So these things need to be reincorporated into nursing with special focus on telling kids this is your reflective learning diaries. I had one PhD student recently in Maharaja Global only, like she was a sister, nun sister from Kerala. What an excellent PhD she did on reflective learning diary, importance of keeping a reflective learning diary for students of third year BSc nursing before they enter the psychiatry postings, So that is the importance of experiential learning. And then what is blended learning is combination of online, offline, different methods like flipped classrooms. We started with flipped classrooms for first years. Like we used to tell them, break them into small groups and tell them, ठीक है तुम लोग ये वाला जो टॉपिक है एनाटॉमी फिजियोलॉजी, तुम एनाटॉमी करो, तुम्हारा ग्रुप फिजियोलॉजी करे, तुम लोग फंक्शंस करो एंड तुम लोग उसका एप्लीकेशन करो. तो ऐसे करके they did that by emails, 100 emails. Every teacher has the emails of all the students, because nowadays everything is like by emails. So they used to do study and then come and present it in the class. So it's in any way. For PGs, it is more like of searching for review literatures and having evidence-based studies to support your pedagogy. And that all they do online. And when they come and present here, they say that we have submitted it online and we have three sets of this. And then when they take the class, they refer to it. So it's a mixture of 2 or 3 different kind of teaching methodologies, offline and online. And before I end, I just wanted to tell one example is flipped classroom and outcome-based education. Dr. Anil was telling, oh, it's terrible. I was just thinking, abhi kahin mere ko padhne mein to aaya nahi outcome-based nursing mein. But we'll have to do it as a part of NAC, because from each semester, the POs, the CEOs, mapping them and getting the outcomes is a big task that again pharmacy college is expert in, because they go for NABL accreditation. So those teachers are expert in doing the calculations. Maybe engineering also we learn from pharmacy, and most of the colleges under state universities do not even know what are POCO, how to do the mapping and how to. It's a very difficult task. Half of the nursing teachers will run away if POCOs are implemented again. All will go and join NHS Trust. If of my age would have permitted, I also would have run away, because the education system is becoming so challenging, so stressful, so many responsibilities for the students, for the teachers. And I saw Dr. Chakrapani Chaturvedi's chat. He says, "Itna sab hoga. So when will we do our annual appraisals? When will we write books, research projects, personal development, CUB, all that thing?" He was asking. But I always learned from my pharmacy colleagues, because in spite of having a semester system, they have the maximum publications in high impact journals. They have the maximum grants and funding they get for the university from ICMR, VST and DBST. And I don't know how they do it. So we really need to, and they write maximum books. And I don't know how they do it. We really need to learn from them. We need to learn to reorganize our time. क्योंकि मैं अगर कोई रूम में आता है तो काम होने के बाद I have the tendency to talk. So I'll try to talk. So we should say कि क्या be brief. Everyone has to do that, and be more focused on teaching and then focusing some time for your individual growth. That is important. So thank you.
Thank you, ma'am. Thank you. We can say like that other department also following from so many years, but we are not following. So we need to understand, we need to learn from others. Sometime also there is a learning method.
Yes.
And for experiential learning like that, as per your guideline, like Nick already stressed on that POCO mapping, and everything is good for already given by the NAEC also. NAEC criteria definitely mention about that experiential learning, different kind of POCO mapping for the syllabus. So that was a good, I think, for future student also. No, thank you, ma'am. Now I would like to again ask from Dr. Larissa, ma'am, what is how we implement the elective and elective module and compulsory subject, because there is a different kind of elective modules given, and there is around 7 to 8 elective modules available. If we talk about the elective module, then there will be a little minimum group like the 2 students, some are 4 students, some 5 students choose their module. Then how we conduct module classes, how we provide the guidelines regarding the module and compulsory courses, ma'am, please.
So what is an elective and compulsory modules? You have 2 electives and you have compulsories. 2 things are there as per the curriculum. Core courses are mandatory courses. The student must study to meet the requirement of the program. So that is what is mainly, you call it as a compulsory modules. So they are the core parts. But coming to the electives, these are courses that one can choose, allowing the learner to study that is interesting to the learner, whereas here the curriculum gives the students which can be the electives. So that is what is the electives and the mandatory modules. Effectiveness of these elective modules are very important in terms of the curriculum. That is, it should not be as a part of the information overload. Because we are in a health education, there is immense amount of information, whether structured, unstructured, so many things are available. So what type of elective that one need to choose is what is the role of teacher comes there. So numerous efforts are there. That is taking the curriculum away from the didactic method of teaching, which we are always being following. That is very important or a very convenient method for the faculty, because it is very easy. We just go lecture and come, which is we have been following from ages together. And they say that currently it is also considered as a dehumanizing method, because there we are promoting a passive acquisition of knowledge, which may be outdated by the time the students graduate, and it may not also be interesting to the learner at the current times. So how do we keep the students' interest alive? That is, one method is by using these modulary learning methods. These modulary learning methods, 2 points are very important. That is, students need to act responsibly and also autonomously. These 2 points are necessary to become using these modules as a successive method of learning. If there is no autonomy, if there is no responsibility from the part of the learner, then it may not be effective. When I say autonomy, it is not that the teacher will say, come, today you do this module, I will be supervising you. No. It is autonomy. You are giving a choice to the learner that they can choose at their own pace, own time. Maybe there can be deadline for that. Okay, deadline is given. Within this period of time, the students have to complete this module. So students can complete it at their own pace. Only thing is not that the last minute they complete everything within overnight. No. We need to see the progress of the module, how they are using. Okay, 10% when did they complete? 20%, 50%. So that watching is required by the teacher. At the same time, the structure of that module is also very important, and the quality of the module is also very important. As already suggested, INC will be giving the modules. Actually, to tell, INC did not want to give the modules, but there was immense amount of requests by so many institutions, heads, the faculty, that they want the modules, because we are used to ready-made things. We do not want to prepare our own menu. So INC thought, at least let us give the module, at least let them use, at least the site or the what type of module to be used. So that's the reason why the council has decided that they will give the modules which they have specified to be used. Otherwise, usually it is I think even now it is the choice of the institutions. If you find the best quality modules, especially from the Minister of Health and Family Welfare, or from some associations, or from WHO, these modules can be used even for a compulsory modules also. The student should be able to work out the schedule. So there should be a schedule for the module also. And the teacher has to just monitor how they are doing. That's it. There is nothing else to be done. And depending on the weekly lessons, it is definitely not enough to increase the proficiency by just completing the modules. But how they are undergoing the modular learning is also very important to make it successful. At the same time, the students also develop confidence that they are learning. I think this COVID pandemic has given an insight how modules can be used and incorporated in teaching also. I think most of us have known so many sites that gives the free modules, and we have also made our students to use those modules, I think, which we were not at all familiar before. I think some of the modules like Swayam of the ministry, which were familiar, but otherwise there were so many modules which we are forced to use because of this pandemic. I think that is really given an insight, and it is like a orientation for the faculty how modules can be incorporated in our regular teaching methods. So that's one of the things. If the learner knows their weaknesses when they are using the modules, they can also improve that by doing self-study with their friends also. So that is also another way how modules can be used. And greater understanding of what motivates the students is what is the faculty need to understand, and such modules need to be guided by the faculty that, oh, this is the interest of the learner, so these modules may be suitable for this learner. That way the faculty can be a facilitator for the students to use the modules. There are 3 main factors which are contributing to the modular choice. One is the intrinsic motivation, that is the interest. The opportunity to exercise responsible choice makes the modular learning more interesting and more successful for the students. When I say the intrinsic factors. That means what makes the learner. There are some extrinsic motivators like expectations, the reward. So how much grade will I get? If I do this module, what is the benefit in terms of my grades? So that is one of the extrinsic motivators. Then module characteristics. When I say module character, it is not only the easiness of the modules, the learners and the modular levels. It should be matching. You cannot take a very advanced modules. Maybe the topic is the same and give to the student. The students may not find it very favorable. And qualitative investigations is also very important by the faculty to be done, so that tomorrow you can use for assessing and the skill as well as the students' cognitive aspects. That is also one successful thing. And many times we find there are some limited modules in particular areas. At that time, the faculty need to learn what are the modules available and guide the students also. And modulation may lead to intellectual incoherence and fragmentation, which may imperil the student's capacity and skill development. That means everything, if you use a module also, may not be good. That's why there are some compulsory modules which a learner has to undergo. It is necessary to be a nurse. So that modules are at the level of the students. And students should consider a mix or balance of modules in making the choice. Like for examples, students may choose an easier electives to take in the same semester, that they must take a core or compulsory module that they expect to find it difficult. So that they may allow, so already a compulsory modules are there which is difficult. So electives let me choose which is easier one. So that balance can be maintained. And a study among the medical students showed that the general attitude of the learner towards the elective programs were varied, with a mixture of enthusiasm and frustration. So frustration is also one aspect that can come if you are not effectively implementing the module implementation. So compulsory modules, which are already specified in the curriculum, should be made available to the student. Students should not be searching from anywhere. That should be given by the faculty in terms of direction, link, site, timing, the pace. All these things should be given by the faculty. And there should not be pressure on the students because the teacher gave the module in the later day. No. So teacher should, like you have the Gantt chart for the research, you need to have a schedule prepared for the students. Faculty, according to their specialty, has to try out all these modules before they could implement for the students. Just say, okay, you do the modules. First, we as a faculty should try it out. All the modules which we think students should be undergoing, those modules should be tried out. Without trying out, definitely we should not be making the students to expose it to the first time. And the main principle of all these modular, whether it's compulsory or electives, are based on self-directed learning, because we consider these children as to be the adults and the professional courses. So self-directed learning becomes the focus instead of spoon feeding by giving notes and dictating all the time. So that's what is electives and compulsory modules in the curriculum. Thank you.
Yes, ma'am. Thank you. Generally, we can say like that the elective module in this syllabus, semester system syllabus, generally INC consider the student interest also. But in previous syllabus, there is no student interest. We consider like that the student also have opportunity to choose as per their choice according to their different specialty or modules elective. And we can say like that is self-directed only, student self-responsible. Only we can guide as a teacher or as a mentor, we can guide the student regarding the same things. Yeah. Thank you, ma'am. Thank you. Thank you so much.
I just wanted to add, we only spoon feed our students so much. This NPTEL modules, this electives, engineering students have to take up. Even we had taken up that fundamentals of basic research as PhD guys. It was compulsory for us. We have to do it weekly on our own, in our own time. No time is given in the college or anywhere. And no one bothers for the students. Only in engineering college, so much of self-directed learning is there. When we went to attend those exams, it was in one of the engineering colleges, and we were all given one computer. We had to register, answer the exams, and come. So that is how the students are doing. It is not our headache at all. They have to choose and they have to do. But we are so much spoon-fed now. Now we are only worried कि हमारे students कैसे करेंगे and all that. So standardized, like Larissa madam mentioned, SWAYAM, like that. If lot of these modules are put in SWAYAM or NPTEL, I think it will be self-directed learning. You have to tell students, you have to go register, prepare for 4 weeks or 6 weeks, do the exam, get the certificate and submit to us. I think that level we need to learn to do in nursing. All of us are spoon-fed, like that is a problem.
Yeah, Dr. Sudha, I would like to bring here. I think we all faculty have to come out of this cushion zone giving to the students. I think I see only nursing that is happening, as you said. Because even if you say teachers be away, teachers don't want to leave the students. They want to come, capture, compare, give a cushion that they may fall. So that is the reason students also many times I feel take advantage of the situation and they are unable to come out of this and they compare that this teacher is giving everything, this teacher is not giving, they didn't tell, this one told me. I think we need to make students more independent learners. That can be, then only the curriculum can be successful. So that anyway, because after 4 years they are working independently. So why in the student period we need to pamper them so much?
True.
Yes.
Dr. Pragna ma'am, I want to ask from Pragna ma'am, registrar. Ma'am is there?
Yes, yes.
Yeah, ma'am, I want to seek one clarification regarding the semester system. Like that, there is a mention like that sometimes we need to submit the evaluation, internal evaluation mark for a whole academic year. Like that, first semester and second semester, we need to proceed in second semester only. So there is a need to understand like that how we proceed for SEM, that like that first year internal marks we proceed. Yeah, we just so represent the result in second semester. So that was the biggest challenge. We want about your opinion. What's your opinion regarding the same? Please.
There are some subject for say, as Dr. Anil Sharma said, like nursing foundation. Okay, we take theory part in first year, we take some practical part in second, means next sem, and ultimately examination will be in the next sem. So at that time, what I feel that as we continue, theory hours and units, and we simultaneously we need to have a the internal assessment. Dr. Ravindra sir has told about the internal assessment, how to assess, and clear-cut idea is given in Indian Nursing Council guideline. The only thing is that we have to go simultaneously. One more thing I would like to emphasize here is that it is written that there should be average 75%, total of all this total of all the students. So we must be careful that there should not be exceed 75% marks. What happened that in private sectors that there is a tendency to give more marks compared to government sector. Generally, government sector they are very strict and very very take care of the students that marks should be as per the rules. But what happened in the private sector that there is a tendency to give more marks. So in Gujarat Nursing Council, what we did that we have utilized our digital platform and we have given artificial intelligence to our system that if there is a more than 75% average, then the system will not accept that marks. So we have handled like that way. So every university should take care of that. I think like that.
Yes.
Yes, ma'am. Thank you, ma'am. Definitely, this system, artificial intelligence, will be innovative and new. I heard like that first time. I also heard like that we can just find out the number of candidate of how many candidates get us above marks like the 70 or 80%. It will definitely help in evaluation system. Really, I'm happy to hear from you regarding that same. Or definitely, all participants also get the benefit regarding that things. And now I want to come on Dr. Ravindra sir. Sir, simultaneously, how we can grow the other learning like that through the CNE for the teachers, like that conference, seminar activity, simultaneously with this semester system, sir. I want to hear from you.
Yeah, we have enough opportunities specified by the Indian Nursing Council syllabus. so that the structure is exactly given. And here more opportunities specifically mentioned in this are the student research projects, students seminars, and the more opportunities, and it is included for internal assessment marks also. So that we are so far conducting all the this kind of co-curricular activities conducted by the PG faculty. So now this will also we have deliberately come to involve the students, and students have to participate, and they have to conduct, they have to organize, and they have to obtain the marks. So that is also included into the internal assessment mark. So that way, one of the very best method I can say, a student will encourage and influence on others also, and they will be the model in the future also, because they will have enough experience. And micro teachings wherever is applicable in CET and educations, micro teachings they conduct. So individual presentations, so focus group presentations with class, and group projects if necessary, if applicable, and reports, case presentations in the practical. So these are the opportunities, are individualized opportunities are given for the students. So report presentation in communities, drug presentations in the hospital, case study, case report. So these are all included in the clinical performance evaluation, continuous clinical evaluation performance. So therefore, these opportunities are very good for the students. So that is the reason it will help them to overall development. So I think so.
Definitely, sir. This will helpful for. I request to participants if they have any doubt, they may be asked from our panelists or experts by using the chat box. They may send their message or any query in chat box. Now we are here for open discussion. If any participants want to seek clarification, they may ask.
Madam, when I was asking, I was discussing the same matter with many more people. The same question was arising. So they say that modules, compulsory and elective modules. I think Larissa madam has clearly mentioned with this, people must have already received the answer. So module is self-directed, self-learned, self-instructional. So may not require a teacher, because many administrators said that how many teachers we may have to appoint there. So 17 modules we may have to definitely we may have to appoint 17 additional teachers who are excellent in that field. So that was the question raised by many of them, so that they have the apprehension clearly, natural. So that is how this may be. Modules can be prepared and uploaded, or can be prepared and kept. So that may be the right way of implementing this syllabus.
Thank you, sir. Thank you. Now, I again extend heartfelt thanks from the Parul Institute of Nursing, Parul University, Vadodara, for giving the Dr. Dr. Pragna Davi, ma'am, Registrar, Gujarat Nursing Council, for valuable time. Thank you so much for regarding giving valuable time. We hope in future also we want to see. We want to see you in conference, seminar, or other activity. Your valuable presence is just we motivate us and other also, ma'am. Again, thank you, ma'am. And I special thanks to Dr. Ravindra sir, Principal, Parul Institute of Nursing, Parul University, Vadodara, for provide the opportunity to conduct this panel discussion and valuable guidance. It also motivate to other learner also, and it also provide the guidance for beginner also. Now I extend my special thanks to Dr. Larissa Martha, ma'am, expert, and ma'am also working in INC inspector. So generally, ma'am, your contributions also give the valuable guidance for me also. Really, I also heard innovative or new things from your side, or definitely that will helpful for the participants also, or to enhance or improve the knowledge regarding the semester system and how we can succeed, which kind of challenges we face, or what is the major differences. All our things will be cover in this session. Now I extend my special thanks to Dr. Sudha Reddy ma'am also. Ma'am, your suggestions and your discussions also provide the better guidance for the beginner also and participants, individual participants, and for other academicians also. How can we deal with the various kind of challenges, opportunities in the exam also with the, related to value-added courses also, and how we can implement in successful manners. All kind of things we hear from you. That is really valuable and knowledge giving things, informative. Now I again thanks to Dr. Anil Sharma sir, principal Charusat Institute of Nursing, Charusat University, Anand, Gujarat, for giving the valuable time. Sir, I also hope I request or I hope from all our panelists regarding to see in future on same kind of panel discussion, conference and seminar, and for giving a wonderful time and clear the doubt of the participants and also giving the efforts. Thank you to everyone, ma'am. If any guidance or feedback from expert or panelist, then open session for everyone, ma'am.
Thank you so much.
Thank you, sir, for this
Thank you.
opportunity.
Yeah, and thank you to Pragna ma'am. She's doing an amazing work, and that AI thing is very good. We will recommend it in our university. Thank you so much.
Congratulations to Dr. Pragna Dati madam also for receiving President's National Florence Nightingale Award for 2020.
Thank you very much, madam. Thank you very much, sir. It is really wonderful seminar. Though it was 1 hour, but you know, it has been extended.
Yeah, I am very sorry
It
for
is,
the
no,
same.
no, there is no, there is no matter of sorry, but it was really, you know, informative session, and I think that it will be really helpful for all participants. That is really very good.
Thank you very much.
Thank you.
Thank you, ma'am.
Thank you, sir.
Thank you to
Thank you,
everyone.
sir.
Bye-bye, all of you. See you all.
Thank you.
Bye.
Healthy and